Pharmacology of Autonomic Nervous System. We know our nervous system is divided into two systems actually, the central nervous system and the peripheral nervous system. Central nervous system, it receives and processes information and initiates action. It is comprised of the brain and spinal cord. Brain receives and processes sensory information, initiates responses, stores memories, generates thoughts and emotions, whereas a spinal cord, it conducts signals to and from the brain, controls all the reflex activities. Peripheral nervous system, it transmits signals between the CNS and rest of the body, and it is comprised of motor neurons and the sensory neurons. Motor neurons, they carry signals from the CNS that control the activities of the muscles and glands, whereas sensory neurons, they carry signals to the CNS from sensory organs. Somatic nervous system, it controls voluntary movements by activating skeletal muscle, and autonomic nervous system, it controls involuntary response by influencing organs, glands, and smooth muscle. Autonomic nervous system is divided into sympathetic division and parasympathetic division. Sympathetic division, it prepares the body for a stressful or energetic activity like flight or fight. Whereas parasympathetic division, it dominates during times of rest and relaxation, directs maintenance activities. Sympathetic division, it has adrenergic receptors, which are either alpha or beta. Whereas parasympathetic division, it has cholinergic receptors. Very simple to understand. Autonomic pharmacology. We are discussing the autonomic nervous system. As I have just showed you, this system is divided into two separate systems. These systems are called the parasympathetic nervous system and the sympathetic nervous system. These systems often produce opposite effects. If we keep this thing in our mind, we will be good in understanding all of the autonomic pharmacology. Drugs in this group are designed to either enhance or mimic the autonomic nervous system or to block the effects of the neurotransmitters at their receptor sites. Parasympathetic and sympathetic, their functions. On the heart, sympathetic will increase the heart rate and increases the force of contraction, whereas parasympathetic will decrease the heart rate and will decrease the force of contraction. On blood vessels, there will be constriction by sympathetic, but parasympathetic has no effect. On lungs, sympathetic will do bronchodilation, whereas parasympathetic will cause bronchoconstriction. On gastrointestinal tract, there will be decreased motility in sympathetic. There will be sphincter contraction and decreased secretions. By parasympathetic, there will be increased motility, sphincter relaxation, and increased secretion. So, in order to have a balanced life, there must be a balance between the sympathetic and parasympathetic. As we know that our sympathetic is fight or flight, whereas parasympathetic is relax and digest. The autonomic nervous system, it has sympathetic pathways which use acetylcholine and norepinephrine. CNS. Acetylcholine, they act on nicotinic receptors and they are governing the autonomic ganglia. Norepinephrine, it is going to act on the adrenergic receptors. This is the target tissue. Through the adrenergic receptor, we are going to act on the target tissue. Whereas parasympathetic pathways, they use acetylcholine only, not norepinephrine. And through the nicotinic receptors, they again act on the autonomic ganglia, and using the muscarinic receptors, they act on the target receptors, target tissues. Parasympathetic nervous system. This system is concerned with the conservation of the body processes. Its main neurotransmitter is acetylcholine. Its receptors are muscarinic, nicotinic, and the somatic skeletal muscles. Sympathetic nervous system. This nervous system is designed to cope with emergency situations. This is commonly known as the fight or flight response. Its neurotransmitters are epinephrine and norepinephrine. Its receptors are the alpha and beta receptors. Cholinergic or parasympathomimetic drugs. These drugs are classified as either direct or indirect acting agents. Direct acting drugs act directly on the parasympathetic receptors, and indirect acting drugs work by either of the two methods. They can cause the release of the neurotransmitter, which then goes to the receptor site, or they inhibit the enzyme cholinesterase. Cholinergic pharmacology cardiovascular. Direct effects include negative chronotropic and ionotropic actions. Relaxation of smooth muscles causes a decrease in total peripheral resistance. Indirect effects include increased heart rate and cardiac output. The resulting effect depends upon the dose used. Usually, the patient experiences bradycardia and a decrease in the blood pressure and cardiac output. On GIT, these drugs excite the smooth muscle of the gastrointestinal tract and cause an increase in activity, motility, and secretion. On I, these drugs, they cause meiosis and cycloplegia. They cause a decrease in intraocular pressure as well. Adverse reactions. They include salivation, lacrimation, urination, defecation, paralysis, and other overdose related reactions. Contraindications are bronchial asthma, hyperthyroidism, gastrointestinal or urinary tract obstruction, myasthenia gravis treated with neostigmine, peptic ulcer disease, severe cardiac disease. Cholinergic drugs. Their classifications are, they have two types, as I have just told you, direct acting or indirect acting. Direct acting choline esters, bethanechol, urecholine, pilocarpine, there comes under other, pilocarpine, and therapeutic uses, bethanechol is used for urinary retention, pilocarpine in glaucoma, pilocarpine also used in a different formulation for xerostomia. Indirect acting, these are reversible agents, the physostigmine. It is used for antagonist in some drug overdoses. Neostigmine, it is used in myasthenia gravis. It is reversible, non-depolarizing muscle relaxant. Even pyridostigmine is also used for the same purpose. Irreversible organophosphates, malathion, parathion, sarin, tabion. Malathion and parathion, these are agricultural insecticides. And sarin, these are, and tabion, these are nerve gases and used in chemical warfare. These drugs, they prevent the action of acetylcholine at postganglionic parasympathetic endings. Acetylcholine is released, but its receptor site is completely blocked by anticholinergic drugs. So these drugs only block muscarinic receptors. We are talking about anticholinergic drugs. Their pharmacology is central nervous system, what they do on it. Depending on the dose, these drugs can cause stimulation or depression. On exocrine glands, they reduce the flow and volume of secretions in the respiratory, gastrointestinal, and genitourinary tracts. On smooth muscle, they relax muscles in the respiratory and gastrointestinal tracts. They delay gastric emptying and decrease esophageal and gastric emptying. These drugs also cause bronchial dilation. On eye, these drugs they cause mydriasis and cycloplegia. On CVS, with large doses, these drugs produce vagal blocking with result in tachycardia. With low doses, bradycardia can also occur. Adverse reactions of anticholinergics include xerostomia, constipation, urinary retention, blurred vision, hyperpyrexia, hallucinations, photophobia, and tachycardia. Contraindications: glaucoma, prostatic hypertrophy, intestinal or urinary obstruction or retention, cardiovascular problems. They can be used as preoperative medicine to inhibit salivary as well as bronchial secretions. They block the vagal slowing of the heart that can occur with general anesthesia. On GIT disorders, they decrease gastrointestinal motility and can be used to treat ulcers, diarrhea, and hypermotility. In ophthalmology, topical use can cause mydriasis, which causes a full visualization of the retina. Cycloplegia relaxes the lens so that proper prescription for glasses can be determined. They are also used in Parkinsonism. They reduce the tremors and rigidity associated with Parkinson and drug-induced Parkinson's disease. Motion sickness. These drugs are also used to treat or prevent motion sickness because of their central nervous system depressant action. In dentistry, we use these in order to control salivation so that we can have dry oral feed. Now comes adrenergic drugs. Adrenergic drugs can be classified as having direct action, indirect action, or mixed action. These drugs stimulate alpha or beta receptors throughout the body. Drugs with direct action like epinephrine, norepinephrine, isoprotenolol, they produce their effect by directly stimulating the receptor site. And drugs with indirect action, amphetamine, they release endogenous norepinephrine, which then stimulates the receptors. Drugs with the mixed action like ephedrine either directly stimulate the receptor or release endogenous norepinephrine. On CNS adrenergic drugs, how they work. These drugs they produce CNS excitation or alertness. Higher doses they produce anxiety, apprehension, restlessness, and tremors. On CVS, these drugs they increase the force and rate of contraction of the heart. Blood pressure is also increased. Total peripheral resistance is also increased. On eye, these drugs lower intraocular pressure and can cause mydriasis. On respiratory system, these drugs cause a relaxation of bronchial smooth muscles. Metabolic effects. Increased glyconeogenesis from beta receptor stimulation and causes hyperglycemia. Salivary glands. These drugs produce vasoconstriction of the salivary glands, which leads to decreased salivary flow, which results in xerostomia. Adverse reactions of adrenergic drugs. They include anxiety, tremors, tachycardia, increased blood pressure, and arrhythmias. Where to use these? For vasoconstriction. These drugs are used in dentistry because of their vasoconstrictive actions on blood vessels. They are added to local anesthetics because they prolong the action of the local anesthetic, reduce the risk for systemic toxicity, and help to create a dry field on cardiovascular system. These drugs are used to raise blood pressure and to treat the cardiac arrest. In cases of severe allergic reactions or in emphysema or in asthma, these drugs are used for bronchodilation. On CNS, these medications are used for the treatment of attention deficit hyperactivity disorder, necrolepsy, and as diet aids. Adrenergic blocking drugs. These drugs competitively inhibit alpha and beta receptor sites. One group of drugs is specific for alpha receptors, one group of drugs is specific for both beta 1 and beta 2 receptors, and one group is specific for beta 2 receptors. One group is specific for both alpha and beta receptors. Antiadrenergic drugs. These drugs reduce sympathetic tone in the blood vessels and decrease total peripheral resistance. This results in a reduction in the blood pressure. These drugs are used to treat hypertension, peripheral vascular disease, that is Raynaud syndrome, and benign prostatic hypertrophy. So over here we are done with these little bit introduction about the drugs which are used in the autonomic nervous system, and we are going to meet soon with the other